Hello, everyone. Um, Thank you for joining us this afternoon for an informative, I hope, installment of Healthy Moms, Strong Babies. My name is Dr. Elizabeth Chareau. I'm the Senior Vice President and Chief Health and Medical Officer for the March of Dimes, and I'll be today's host for the webinar. Today we've got a really timely episode, as January is National Birth Defect Awareness Month. We partner with the CDC, as the CDC recognizes January as the National Birth Defects Month. And we partner with to generate awareness among expecting mothers, they're also expanding, and families about the facts surrounding birth defects and the impact that a birth defect has across the stages of life. So today, did you know that this is sort of an interesting fact that in the United States today, that 1 in 33 babies is born with a birth defect? Your genetics, behavior, and social and environmental factors can all impact your risk for birth defects. So, and not all birth defects can be prevented. So I want to make sure we get that message out today. So as we talk about birth defects today, we really are concentrating about awareness of birth defects across the lifespan. It is important to recognize that birth defects can be a condition, and it certainly impacts the course of an entire lifetime for a child. So not just the individual with the defect, but actually the whole family. So excited that we have some real stories here today to share, and we want to really highlight them and their efforts to improve the health and outcomes of people living with such conditions, as well as their loved ones. So while not all birth defects can be prevented today, we'll be discussing steps that can be taken as one prepares for pregnancy to ensure the best chances for your baby to have a healthy start in life. So again, we'll hear from parents of children with Down syndrome and congenital heart defects so that we can understand firsthand the realities of parenting children with special healthcare needs and some strategies for mitigating the effects of birth defects. So in addition, we'll be hearing from the president and CEO of the Spina Bifida Association, who can speak to the importance of access to education, information, and support for individuals and families affected by birth defects across the lifespan. So before we return to introducing the panelists, I just want to make people aware of following a hashtag across the lifespan and hashtag birth defects. And lastly, go visit the March of Dimes website. So it's marchofdimes.org with /birth defects. We'll share all those links in the chat later and towards the end of today's program, but invite you to join the conversation about national birth defects. So let's get started with the panelists. So I'm first going to start by introducing the panel of experts who will be sharing their expertise and personal stories today. Unita Rifus, PhD, is an epidemiologist and the branch chief for the Birth Defects Monitoring and Research Branch in CDC's Division of Birth Defects and Infant Disorders. In this role, Dr. Rifus oversees birth defect surveillance and research activities to identify causes of birth defects, find opportunities to prevent them, and improve the health of those living with birth defects. Thanks for joining today, Dr. Rifus. Next up is Amy DeSantis. Amy is a mother whose son was born with Down syndrome and a congenital heart defect. And I believe she's coming from us from Ohio today. So thank you for sharing your family's story today.
Thank you for having me.
Great. Carol Lee, who is an NBC News White House correspondent, also an advocate for moms and babies. Her second child, 1.5-year-old son, was born with a cardiac birth defect called transposition of the great arteries. So she's here to share her family story as well. Thanks for coming, Carol. Finally, we have Sarah Struwe, President and CEO of the Spina Bifida Association. Sarah leads the SBAA's effort to link those affected by birth defects, the birth defects spina bifida, with education, information, connections, and support. So like the March of Dimes, Sarah's organization is also a leader in research, professional education, and advocacy to build a better and brighter future for those impacted by spina bifida. Okay, now that we've met everybody, let's get started. As a reminder, I encourage everyone joining us for the webinar to use the Facebook comment section to send your questions, and we'll try and address them. All right, and again, just one last reminder, we'll put the hashtags and the links at the end. So again, thank you all for joining. So let's start. Dr. Rifus, you ready? Great. So I'll have you come off mute, and just a quick, thanks for coming today, and I'm so grateful to have your expertise today on the panel. And I'd love to be able to start with, if you'd explain to our audience what exactly a birth defect is, how it can affect families and babies around the world.
Yes, thank you very much for having me, Dr. Shiro. Birth defects really is a broad term that we use to describe a large variety of structural changes that are present at birth that can affect pretty much any part of the body. So the heart, the brain, the foot, it really is a broad gamut. They may affect how the body looks, works, or both, and can vary from quite mild to really severe. Birth defects is a collective term that we use to describe the entire group of conditions we look at, but I really prefer to talk about specific conditions just because each type can really vary in their severity and the impact that they have on the individuals. I do want to give some examples of birth defects. So for instance, cleft lip, which a lot of people are familiar with, where the tissue that makes up the lip doesn't quite join completely, resulting in an opening in the upper lip. Gastroschisis is another birth defect where there's a hole in the wall of the tummy and some of the intestines are not inside the body when the baby is born. Or craniosynostosis, where some of the bones of the skull grow together too soon, resulting in abnormal development of the skull. And those are just 3 examples from a much longer list, including several which I know the other panel members will be talking more about. You also asked about how they affect families and babies around the world, and the impact on the baby's life and the family's life can be quite substantial depending on which condition the child has, when the defect is diagnosed, and what the treatment options are that are available to the family. Thankfully, there have been very many advancements in medicine and surgery over the past decades, which have led to better survival, and more children are born with birth defects grow up to have full lives. So that's great.
Yeah, that's great. As a provider or as a clinician, I'd love to hear about how they're identified or diagnosed. So when you talk about cleft lip or gastroschisis, how does one find out during their pregnancy?
Yeah, as I mentioned, there's many different types, and identification of diagnosis can really vary. Some birth defects can be found before birth during pregnancy. Some are visible or can be diagnosed at birth, but then there's also some that are not identified until sometime after birth. Prenatal diagnosis is when birth defects are identified during the pregnancy, and this can be of incredible value to the family. You can imagine that if you have a baby with gastroschisis, it would be really helpful to know before delivery so that there can be a team at the ready to care for the baby as soon as the baby is born. Another example is congenital heart defects, and understanding when and how a heart defect is discovered may help improve care and long-term outcomes. So we at CDC are working with 8 states to collect information on when and how critical congenital heart defects, which are those that really require surgery in infancy, were found. Critical congenital heart defects can be identified prenatally via ultrasound, immediately after birth with pulse oximetry screening, which is the little test that they do where they put a little scanner on the baby's wrist and ankle, or they can be after birth when the child shows symptoms. And I think especially for those critical congenital heart defects, finding them as soon as possible is really important because they don't always show up right after birth, and we really want to make sure that those babies with these conditions don't go home without having been diagnosed, because they can become very sick very quickly.
Interesting research you're doing, and I can't wait to hear from our panelists too, just about their stories. But I would also ask, do you have any advice for expecting parents who have a known history in the family of a birth defect?
Yeah, I think it's really important for all couples to realize that pregnancies start out with a 3% chance of having a baby with a birth defect. If you have a family history that includes a birth defect or a genetic condition, you may be more likely to have a baby with that condition as well. And so this is why around Thanksgiving, we at CDC often highlight a family history tool that we have, because especially around Thanksgiving, when you get together, it may really help your family collect their health history, which can be really important for folks to be aware of. And to learn more about your genetic risk of having a baby with a birth defect, you can talk with a clinical geneticist or a genetic counselor, and they can really help you address concerns about different risk factors that you may have, including genetic conditions that might run in you or your partner's families.
I love that. I love having, specific to the family history to really get into the
Mhm.
detail. How about finding resources for parents and information to support the child as they grow? So something we're really looking at this year.
Yeah, thanks to the improvements, we see that a lot more kids grow up, and that's terrific news. But meeting the complex needs of a person with birth defects can be challenging at times, and often involves the entire family and sometimes extended family. Having access to information to help you figure out what to expect and how to plan for the future and how to get your child ready for that is really important. And your caregivers, a great resource to start with are patient and parent organizations. So I'm sure Sarah will say more about that, especially those for your specific condition, because they're often made up of individuals and parents that have the lived experience and have gone through what you are experiencing right at that time. And they can really be a great organization, both for expecting parents and for families after the child is born. But also, your healthcare provider and your whole medical team should be another great resource. Ask questions, learn about your child's diagnosis, medications, and treatment plans, and don't be afraid to keep asking doctors, nurses, and other medical professionals questions. I think, it's very overwhelming early on, and they're all happy to keep answering questions and really get to the point so that you feel comfortable and know what's coming up next.
But
One,
one last question.
uh-huh.
I wanted to sort of focus on adolescence,
Yeah.
not my world at all, right? I
Yep.
deliver a baby and I expect the team is going to be there to help. And then I'm done from the child side. So
Yep.
what about, for adolescents or even in adulthood, how does care for a person with a birth defect change throughout the phases of their life?
Yeah, that's a
That's a
that's a
big
really
question.
good point. It does change a lot, and we're doing a lot of research trying to figure out kind of what that care is for the different birth defects that we're looking at. So, for instance, for a kid born with a cleft lip, the surgery will happen in the first couple of months, but there will also be a need for other types of care. Usually, there's a need to have special dental care, special orthodontic care, speech therapy. So there's a lot of things that come afterwards that they might need as they get older, and that's really something that we're looking at, as well as the transition of care. So a lot of the kids, they'll get very familiar with the pediatrician that has treated them since they were born, but then they're going to have to shift when they're a teenager. One, they need to start making their own healthcare decisions if they can, but then also they need to find adult care specialists, and that can be really hard. So those are just some of the things that we're
Yeah.
working on and hoping to provide more information on.
No, I love it. That's we need to do the whole transition of life. So, and thank you. Thanks so much. That was fantastic. So let me shift to Amy. Amy, I'd love to hear about, if you could start sharing a little bit about your story and talk about your twins and your delivery and what happened.
Okay, so my name is Amy. I have twins. I delivered them at 37 weeks. I had a fairly healthy pregnancy. I had a few miscarriages leading up to having the twins. So with the twins, I was high risk. We did all the prenatal care. They did not know that anything was wrong with Quintino at birth. I had a boy and a girl, Giada and Quintino. Giada, it was healthy. Everything was fine with her. We found out at birth that Quintino had Down syndrome and quickly learned that he had a ventral septal defect and a rather large one. I did have a prenatal echo. There was maybe like at 28 weeks, they just wanted to check and make sure everybody was okay. So we did an echo and it did not show anything for Quintino. The only thing during our prenatal care that showed up is one of his femurs measured a little bit smaller than the other one. And then nothing else showed up as far as any Down syndrome type of testing. They did they measured his knuckle ridge and they looked at a few other things. And really there was no indication that, anything was wrong at that point. The echo looked great. Everything else looked okay. So when we delivered is when we found out. and quickly right into NICU. And he was very unhealthy at that point, very sick. We were there. They thought we would be able to go home in the first 3 weeks. He had a feeding tube. Um, he was on oxygen. He kept getting new, what they call upper lobe atelectasis. Every week he'd have a new one, and they would say, "Oh, it's just the Down syndrome. He's not breathing correctly." Well, here, I think he was silently aspirating the whole time. So he just, it was just sort of each week we kept hoping to go home, and then he would have a new area in his lungs that, showed up. So we finally got to go home at 3 months. It was a very exciting day to be able to come home. We did come home with a heart monitor, with oxygen, with the feeding tube, all of that. We were home a very brief time. He was running high fevers and just very sick. So we ended up back in, and we were in for another week. They sent us back home. And then we ended up, he ended up having to be life flighted. He was not doing well at all, and started to decline just rapidly, just enough time for us to get him on the Air Bear in that helicopter and up to a children's hospital fairly close to us. And then we remained there until his open heart surgery. They were born in July 6th, and he had his open heart surgery December 12th. So prior to the open heart surgery, they put in a permanent feeding tube. They did another procedure so he would not be able to aspirate, called a Nissen fundoplication. They did that as well, got him stable. He started to do great, started putting on some weight, and then he reached his 8 pounds by Christmas. And then at that point, they were able to do the open heart surgery, and we actually made it home by Christmas Eve. That was our Christmas miracle. He was alive, and we made it home.
So
And
how is he doing today?
today he is thriving. He has a lot of other medical issues as well that we learned later, but as far as from the cardiac issue, he has been cleared. We do not have any further follow-ups. He is doing great. And from a Down syndrome perspective, he is great. He's mainstreamed. He's doing very well. He's thriving. He will do whatever his twin sister does and all of his friends at school, his typical friends at school do. He just does it on a different timetable. And we always say it's Quintino time. He's differently abled, but he will do everything and anything that a typical child does.
That's amazing.
Just in, and again, different time frame.
So going from what you're expecting to be, almost full, 39-week delivery, right? You're right on the cusp to, an acute event, and I'm sure it's incredibly stressful. Again, being an obstetrician, being there for delivery, and then all of that going right into a surgery or being life flighted somewhere else, it's got to be an amazing trauma. I guess I would want to know what support or resources were the most helpful for you.
My husband and I are very fortunate that we had a ton of family support. So we have a wonderful, wonderful strength within our family and our closest friends, or we could not have survived. We also tapped into the local Down syndrome organization. They had reached out to us, and they were fairly new at the time. They were only a few years old. So I do believe that helped as well, because there was just a plethora of information within their library, and networking of other specialists that other parents had sort of had similar situations as us that they referred us to. And we just sort of kept almost like a 3-ring binder of names we were given, and different types of, the early intervention for the Down syndrome therapist names, and, just sort of how to navigate it. We asked a lot of questions, we reached out. And I do think in the midst of all of that, your fear, the fear, the second you get that diagnosis, you're fearful for is your child going to survive, what their life is going to look like, what is your family unit going to look like, how will this affect his twin sister? There's all those things. And then you're also fighting to keep your child alive. And, there's no one can give you a timetable. Will they walk? Will they talk? There's just such a, the gamut of what your child can have with a birth defect is so different. And I think that unknown gives you so much more angst, and so much more fear. And I do think you just have to kind of find your voice and find your inner strength to say you are the advocate for your child. You're the only one that's going to be able to protect them and fight for them. So you have to dig deep. And we did that. At that point, we had this binder, and it was like our Bible. I mean, anything anybody said to us. And then when we had the second, we would look into that. But I do think the strength in a community that has, if your child has any type of birth defect, sort of tapping into that community and getting some information
Great
is a
advice.
huge help. And I
Yeah.
think there's a lot of networking now that, you know, even 13 years ago for us, it wasn't
Sure.
as prevalent. And I do think, you know, that those outreach groups and things like that, when someone's walked in your shoes, they can give you, not that they have to give you advice, but they can at least point you in the right direction. And, you know, that does help.
Appreciate it. Thanks for sharing your story, Amy.
Yep.
I know. Carol, I'm going to shift to you, and I really can't thank you enough for your public presence to be an advocate for moms and babies. So your second child was born with a cardiac defect, and I understand it was the transposition of the great arteries, so great vessels. So what normally would pump the lungs versus what would normally pump the rest of the body switches, and it is, to me, and we shared this before, is kind of an overwhelming to have to be the provider to share to. I can't even imagine to be in your shoes. So, so because of these being reversed, you know, can you, and you know, your story is different. So I'd love you to share what you found out with the diagnosis and how your son is doing today, et cetera. So.
Thank you. Yeah, my story is different from Amy, and I feel very blessed for, you know, that Monty, my 18-month-old, you know, he had a very serious issue, but it was something that once I got through the fog of what is happening, you realize that it's manageable. So I was 16 weeks pregnant, and a test that I had came back abnormal. My doctor thought it had to do with spina bifida, and, you know, it's COVID. So I was alone in the hospital getting this test done, and my husband was outside pacing the sidewalks. And she made clear his spine looked good, but she was spending a lot of time in this area. And so I was getting very suspicious. And then the doctor said that afterwards that it appeared that Monty had this transposition of the great arteries, which I had never heard of. And so we had to get that confirmed. We went to Children's National Hospital here in Washington, D.C., and they confirmed that. And then they confirmed that we couldn't really know the full scope of it. It looked like a couple of other things could potentially be very wrong. And so in talking to my doctor, my OBGYN, he said that the way that Washington's hospitals are set up, that I would deliver at one hospital, and then the baby would be transferred away to Children's Hospital and be taken care of. So we would be separated. And I wasn't having that. That was not in my plan. It really gave me a lot of anxiety. So I just did a bunch of research, and it turned out that Children's Hospital of Philadelphia, I grew up outside of Philadelphia, so I'm a huge fan of the Philly area, obviously, that hospital has a delivery unit. It's called special delivery unit. And so, and you can self-refer, which is amazing. You don't need a doctor's referral. So I self-referred and set that all up, and we went there, and it was just very obvious that that's what we needed to do. Because one of the things that they said was they knew, you know, he would need to have this surgery, but they don't know how he's going to come out. And it turned out he came out terrible. He wasn't breathing. He had an ABCAR score of, I think, 2. He was, I mean, ironically, the only thing he really had was a heartbeat. And so they immediately took him. I didn't see him. I mean, something went wrong with my situation too, and I had a blood transfusion, but that aside, I didn't see him for 9 hours because they were working on him.
Yeah.
And then 4 days later, once they managed to work him off the breathing tube, and they did the open heart surgery, and he was 9 days. My husband's in the military, so he had this whole goal that he was going to be the fastest out of that. Yeah. Right. Very competitive. And so he recovered pretty dramatically fast. And he was out of the hospital within 9 days after surgery. We took him home. He had the feeding tube. We stayed in Philadelphia for a few more days. He went back in the hospital. He wasn't well. And then when we got home in Washington, he was back in the hospital again because the incision was infected. But now he's, you know, he goes to his annual checkups now. They used to be every 3 months or 6, and he looks good. He's mostly on par where he should be. He has a few developmental delays. He's not talking, for instance, which we're currently dealing with. But he's really thriving in all these other ways.
That's great. That's really great. It sounds like you were prepared and really did a ton of research, which honestly, Carol, I would expect from, with the line of work you're in, right? You were probably massively prepared. How did the medical team help prepare your delivery and for what to expect? And I'd be curious if you could just talk about that a little bit.
Yeah, first of all, everyone who works for CHOP should be sainted. They're all wonderful. And they walked us through all the different possibilities, what it would look like, everything from, here's where you could try to sleep in the hospital if during the surgery overnight, here's, you can come and go as you please, walked us through everything, walked us through all the possibilities of what Monty could be like when he came out in terms of his health conditions. And at the same time, they did everything they could. And Monty actually, he had the transpituitary arteries, and then he had his aorta was not correct. So they had to fix that. And that's probably the one thing that if there's anything that comes back to him that he would need to have fixed again, it would probably be that. But they did everything they could, but there's really nothing that prepares you for that. I don't know. I mean, when you hear he's not breathing, it's just like, yeah. So
yeah, I'm sure that will stay with you actually for a really long time, and always think about sort of the effects of that over time on a lot of moms. So it's can be really hard. Initially getting the diagnosis, and to Amy's point, sort of fight or flight kind of responses, and then you start processing this kind of overwhelming. But thank you for sharing your story. I'm sure I'm going to come back to you. I probably have 5 million questions, and I think we probably know some of the same people from CHOP. But but thank you. Let's start with that, and then I'll get back to you. But let's move to Sarah. I'd love to talk to you, Sarah. If you can tell us a bit about the spina bifida and how it affects people, because honestly, I think a lot of people have no idea what it is until they hear it from a doctor and that they're being screened by it, or somewhere, and would love to hear about families that and how they're affected across their lifespan.
So first of all, I'd like to say, while there's a diversity of birth defects, the experience is pretty much the same across the gamut.
Great.
It's regardless of the birth defect, it's almost identical. I was struck by that listening to the panelists, and thank you very much for inviting us to be a part of this. So spina bifida is a birth defect that occurs in the first 4 weeks that a woman's pregnant. So typically long before she even knows she's pregnant. And it occurs when the brain and the neurotube are developing and creating the spine. And what happens is the spine doesn't zipper up the way it's supposed to, and it leaves the spinal cord exposed. And depending on where that lesion occurs on the spine will have a huge impact on whether or not somebody can walk, whether or not they can go to the bathroom on their own, what kind of learning abilities they will have, all kinds of different things. It's actually the most common permanently disabling birth defect that's compatible with life. When you think about it, there's not a whole lot else that people survive that is as complex as spina bifida, because it really involves pretty much every body system. It involves the brain, it involves your spine. When your nerves and all of your muscles is controlled by the spine below where that lesion happens, develops atypically. So people may walk, but they may have a very funny walk. Some people may not be able to ambulate. They may have to use a wheelchair to get around. Some people may choose to use a chair to get around just because it takes so much energy to walk on their own. And as they age, they typically tend to start using wheelchairs more for that very reason. One of the things most people don't understand is that most people who live with spina bifida in the United States are actually adults. They're not children. But it's still considered by the medical community to be a pediatric condition. And the same diagnosis is still happening that happened 30, 40, and 50 years ago, which is, I'm sorry to tell you, your child has spina bifida. When would you like to schedule an abortion? Most doctors do not realize that people with spina bifida can live a long, healthy, and fruitful life. just given the support that they need and the medical support that they need. And like Anita referenced earlier, they get great care as children. Children's hospitals across the country provide the best care possible. And it's very coordinated, multidisciplinary care. It's very difficult kinds of care. But when they age out of that system, they can't find people who have the expertise, who understand about their conditions. It's one of the big problems that's facing the birth defect community across the board. And so the experience in children is much different than the experience in adults, because without that preventative care as adults, they succumb to things like a urinary tract infection that may claim their life because it doesn't get treated. They may wind up having to have dialysis or a kidney transplant because of the long-term scarring of their kidneys. So it can be very complex as they age because they don't get the kind of preventative care that they do in children. So that's the big crisis facing our community.
Interesting. How does a pregnant person, what should they know about prevention for spina bifida?
First of all, if you're a woman of childbearing age, you should be taking folic acid, period, across the board.
Right, 400 micrograms. Yeah, 400
right.
micrograms.
And
right.
depending on your family history, it may be more.
Yeah,
but
I think that's exactly what I want to make sure people hear. You can say it again, Sarah.
So depending on your family history, you may need to take more folic acid, but the big thing is take it early, take it before you're even thinking about getting pregnant. Because once you're pregnant, it's too late. The gate is closed and the horse is already out. So, I mean, you're just really taking a risk by not doing that. So if you're a woman of childbearing age, take your folic acid, important. But the other thing that I'd like to say about the medical community, which they're great partners to us, but OBGYNs and Dr. Sherrod, no offense to you, most of them don't know much about these birth defects, and they immediately go to the worst case scenario. And that's the reason organizations like mine are so important, because they give people the opportunity to talk to people who are the true experts, for the people who live with it on a day-to-day basis, either as a parent or an adult who has it themselves. Right. So I think it's really important for people to get that perspective too before they make those decisions. And it happens early. It happens at that first ultrasound. And so, you know, reaching out as soon as you find out is really important so that you can make better qualified decisions.
Yeah, I like that you have education and information and connections and support. What else is your organization doing?
So we advocate on behalf of the National Center on Birth Defects and Developmental Disabilities for the National Spina Bifida Patient Registry. It's the only registry of its kind. It's the place where they're looking at long-term what happens to people with spina bifida and what are the best ways to care for them to ensure that they're healthy throughout their entire lifetime. We advocate on behalf of other disability issues as well too, but that's our primary focus is that registry, because it's where the research is taking place that's going to make a difference in people's lives. And we're also really involved in clinical care. We're trying to change that paradigm for those adults in particular. We're focused on finding adult providers who are interested and willing to learn about spina bifida and educating them on it so we can have a better health field available for our adults. And we're also trying to work on the other end, which is the side that you've been on, which is educate OBGYNs about what it's like to have spina bifida and a better way to provide that diagnosis.
Carol, what should people make sure to ask their care provider? Maybe specifically about heart defects, but really about birth defects. I guess I listened to your story and Amy's story, and I maybe it's because I'm default the provider on here to think about what could I do better to support you.
The resources that I found best are those organizations that focus most on specifically congenital heart defects, but also just the medical community. I mean, I sound like I'm doing PR for Children's Hospital of Philadelphia. I'm not, but there's an openness and a willingness to just provide information and answer any question anyone has, and to be treated like family. I mean, I spend a lot of time on the internet. I don't recommend that, researching things, but yeah, that would be my answer.
Okay, great. How about piece of advice what piece of advice would you give to families facing a new diagnosis? Do you want to go back to you, Sarah, on that one? What's the one thing you would tell them?
First of all, don't believe everything you hear. You're going to be an expert in your child. The experts may not know as much as they think they do. And so talking to other people who've lived that experience, I think, is really critical.
I like that one. Amy, got the same question. What piece of advice would you give to a family?
I think the first thing is to take a breath, take a deep breath, and kind of collect your thoughts. As overwhelming as it is, you will reach out. You have to find the right people to reach out to, but you just actually have to take a deep breath. Your life is going to look different, and you have to grasp that. And then you have to find a way to move forward and figure out how you're going to handle and tackle whatever is just been laid out in front of you. And then you find the right healthcare providers that to kind of drive that care, and you reach out and network to the organizations that are, whether it's local or national, that you can find that are relatable to your situation. And then you find other parents in those outreach groups that, have dealt with very similar to what you are. And you can look at, exactly where you're at, but you can also look a little bit ahead to kind of say, okay, this is overwhelming, this is fearful, but there's hope. Look at this child has now reached 5 years. This child has now reached 3 years. This child has now reached 10 years. And that gives you that hope, to keep fighting and to keep going. And I think the first thing is to just take a breath, and it's going to be okay.
Appreciate that. I think from parent to parent, I think I'm hearing it's a good idea to, really come together as community. And I like that. Dr. Rifus, maybe I'm going to switch gears just a little bit, but where's public health focusing its time and attention to ensure that people impacted by birth defects are supported?
Thanks for the question. We're trying to get to the points that you're bringing up. It's really trying to assess the challenges and the healthcare needs that people living with birth defects may have across their life. And for public health specifically, we really try to focus on population-based work. This means that we try to describe what happens to everybody living with a specific condition in a specific region, regardless of which clinic you go to or which clinic, if it's a specific clinic, or if you're a member of a patient organization or not. We really try to encompass the entire population, because that's the only way also that we can promote equity in care and health outcomes.
Great. Super. That was really helpful. All right. Listen, the panel tonight has been great. I loved every minute of it, hearing the patient story, and also just I like focusing on where one should go or do to really focus there. And it sounds like all of this is really about advocating for your own child and your own family. So I love all of that. I guess the last question, and this was, I know there's always curveballs at the end, but I'd love, maybe Sarah, you can speak to this one. How does your organization embrace diversity and equity and inclusion? This is a hard one, right?
Well, it's something I think every organization struggles with, to be honest. We're not perfect by any means, but we've really started to take a look at ensuring that the voice of the individual with spina bifida and their care partners are included in everything that we do, in every decision we make, in every program we do, everything. And we're trying to make sure that that voice is included in the discussion, so that we're moving in the direction that makes sense for them. So that's one way that we're really focused on inclusion. But we are also looking at other groups. Most people who have spina bifida in this country actually are of Hispanic descent. And so we're trying to figure out how we can make better inroads to meet some of those people and where they are, and see if we can do a better job with them. We just recently started a group. There are several people who are gay and lesbian and queer within our organization, and So we're trying to figure out how we can do a better outreach for them. And so as we identify groups, we try to bring people who are in that group together with us to help us identify the best way forward. So that's how we focused on doing it.
Got it. I thought that was great. Thank you. I appreciate everybody today. Thanks so much for joining. And, once again, really want to just, this is a great month to really drive home what we've been trying to do. This has been a great Healthy Moms, Strong Babies webinar. I want to thank all of our guests today. I thought it was super informative. Even as a provider who delivers this information, I learned a lot today. I'd like to say special thanks to the CDC, for supporting this. And we hope we're able to answer a lot of questions today. I will remind everybody to please visit the marchofdimes.org/birth defects to learn more. And as I mentioned in the beginning, we'll get to the links, perfect timing, as I said it, and the hashtags, so that you have resources through these slides, and they should be. And so thank you, everyone. Appreciate your time.